before anyone panics about what a full mouth implant might really involve, let me just say this. Most people only hear the headline numbers, not the story behind them. And today, Dr. Esma and I are pulling back that curtain. You might think you already know the cost, but trust me, there are layers, surprises, and even some hidden opportunities.
Exactly, Rasim. People often focus on one number when the real picture involves biology, materials, long-term function, and yes, choices they never knew they had. But don't worry, we'll make it simple, clear, and maybe even a little fun.
And stay with us, because in a moment, Dr. Esma will reveal the single factor that changes the entire cost conversation, but almost nobody asks about it. You're going to want to hear this. You know, Dr. Esma, people message me all the time saying they're confused. One clinic tells them one thing, another clinic tells them something totally different, and suddenly they feel like they're trying to decode a secret map. And honestly, I get it. When you don't know what's essential versus optional, everything sounds urgent.
You're right, Rasim. Many patients arrive thinking they need the most dramatic solution, and sometimes a thoughtful plan saves them stress and improves their long-term results. But no one explains these scenarios clearly, so people assume every recommendation is the same everywhere.
And that confusion leads to hesitation. They delay fixing the real issue until it becomes even bigger. Today, we're breaking that cycle by showing what truly affects the treatment path. So here's why this whole conversation actually matters, Dr. Esme. People think they're choosing between different versions of the same treatment, but in reality, they're choosing between totally different futures. I've seen folks go from barely chewing soft foods to actually enjoying meals again, and that's not a small deal. And it's not a small deal.
Exactly, Rasim. When someone has chronic discomfort, bone loss, or missing teeth, the impact goes far beyond appearance. We're talking about function, confidence, health, even how they speak. Each case has its own tipping point where the right decision changes life quality dramatically.
And that's the part most people never hear. Not just what the treatment is, but what it prevents later. Once you understand that, the whole picture starts to make sense. Dr. Esma, I remember a viewer who wrote to us saying they'd been living with temporary fixes for nearly a decade. They thought the situation was normal until they realized their chewing strength had dropped dramatically. It shocked them how much they had adjusted their life around discomfort without noticing.
This happens often, Rasim. One of my patients had been avoiding certain foods for years. When we evaluated the scans, the bone loss told the real story. After proper treatment, they told me the most emotional moment was taking the first confident bite of something they once avoided.
And that's a powerful reminder. These cases aren't rare. People adapt to problems they think are small until the long-term impact finally hits. Understanding that background changes how you see the real cost. Now, Dr. Esma, this is the part everyone leans in for, the science behind why treatments differ so much. People imagine implants as simple screws, but there's a whole biological story happening under the surface. And when you hear it, you start understanding the real difference between quick fixes and long-lasting work.
Exactly, Rasim. The implant doesn't just sit in the bone. It integrates with it through a process called osseointegration. Bone quality, density, and healing capacity all shape the outcome. These biological variations explain why two patients with similar appearances may need entirely different approaches.
And that's the missing puzzle piece. Your body's chemistry, your bone structure, your healing timeline. Without that context, every estimate looks confusing, but with it, everything clicks. Alright, Dr. Esma, let's get practical. People love a clear roadmap, so let's walk through the exact steps that turn confusion into clarity. First step, a real assessment. Scans, measurements, bite evaluation, basically letting your mouth tell its true story.
Exactly, Rasim. Then we design the plan. This is where we match the anatomy with the right number of implants, angulations, and materials. After that comes the placement phase, where precision matters most. Healing follows, and depending on bone response, the final teeth are crafted.
And the last step, function testing, making sure chewing, speaking, and comfort all sync perfectly. When people see it laid out like this, the process suddenly feels doable. Now, Dr. Esma, before anyone rushes into a decision, we've got to talk about the big do's and don'ts. People often make choices based on the fastest promise instead of the safest plan. And that's where trouble starts.
Absolutely, Rasim. A major don't is choosing a plan before a full diagnostic evaluation. Skipping scans or rushing consultations can lead to mismatched expectations. On the do side, always ask about bone health, implant angles, and healing stages. These simply cannot be guessed.
And here's another key. Don't compare yourself to someone else's treatment plan. Your jaw, your healing timeline, your anatomy are unique. Once people understand that, they stop chasing shortcuts and start making informed decisions.